Hello and good evening. My name is Zilla Dragovsky and I'm here to present to you the emergence of lifestyle medicine. I'm going to have to skim over it because I know I don't have that much time. So the emergence of lifestyle medicine started around my birthday, which was around 1998 to 1999. So it's been around for 27 to 28 years. And it is an area that is still to be fully blossomed because it's only just becoming something more mainstream, and I'm excited to see where it will go in the next few years. But the earliest concepts of health practices can be seen in the ancient people of the Bible, found in the book of Leviticus, which promoted that after touching the dead bodies or diseased animals that they would wash their hands, as well as avoid things like blood and mold, which we know about. And it also advocated a plant-based diet where it didn't actually promote that people ate meat in their diets. So moving on to a pioneer, someone very famous. Her name is Florence Nightingale. She pioneered health care and the profession of nursing. She set the standard. She was beyond her time. She believed that by using simple remedies like fresh air, light, warmth, cleanliness, quiet, and the proper selection of healthful foods can actually help patients be cured. She saw treatments like bloodletting, which is the withdrawal of impure blood, to cure and prevent illnesses, and giving toxins like arsenic, mercury, and opiates actually caused more death than the cure. She especially proved this by applying these principles in 1854 during the Crimean War, and she managed hospitals and continued to publish writings on quality healthcare and management until her death. Ignaz Semmelweis, he is the doctor who championed hand washing. He saw that many mothers were dying from streptococcal A infections, and he did some data collections, and he saw that the groups that washed their hands between each patient and after each case, he saw there was a dramatic drop in death rates. And someone else that we can thank is Louis Pasteur. He's a French chemist and microbiologist that discovered that germs, bacteria, microorganisms cause fermentation and disease. And he invented the technique called pasteurization, which is still used today and helped beer, wine, and silk companies. And he also helped create some vaccines. Joseph Lister, he adopted this theory and invented the antiseptic solution, in which they named in honor of him, called Listerine mouthwash. And John Snow, he was the father of epidemiology as well as public health, as he discovered cholera, and that by getting permission from the council to take the tap off, he could actually prove that it was this infested water source that was causing the outbreak of this disease. Then in 1943, we can see that someone by the name of Alexander Fleming stumbled across by accident on a dirty workbench the very important penicillin antibiotic. And just only 2 years later, in 45, its use was so widespread and so popular that already resistance was starting to be seen. So when I say resistance, it means that the antibiotics were simply not working because the body was already able to become immune to it. And so then they went on and created vancomycin in 72, resistance 16 years later. Imipenem in 85, resistance 13 years later. Daptomycin was created in 2003. In 2004, resistance was already seen. So MRSA is something that around the world we're struggling with now because we're running out of antibiotics. And the World Health Organization can say that it is associated with longer hospital stays, increased death rates, higher costs in healthcare, and it's just a never-ending battle. And we don't have much more to go. Someone at the Australasian Institute of Lifestyle Medicine has said that in 20 years, we will be back to the days of pre-penicillin. So the Australian government addressed this issue just by monitoring animal and human initiatives to make sure that we're not overusing and abusing antibiotics. So the World Health Organization has stated that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which is a controversial statement to some. But why is it so hard for our society to have this definition of health? Well, you can thank that to the benefits of having mass food production. It has come at the expense of our health, of our welfare for not just us, but our animals. Human equality rights have been overridden, as well as the abuse of our environment. We're just not doing it in a sustainable way. And we're now living a more sedentary lifestyle, which has the average adult being 60 to 70% less active compared to those 100 years ago. And that can be due to our very technological society. We can now fit more things in because we are more able to have everything at our fingertips. And we can see that this is linked to the large levels of stress and depression in many of our young adults. So within Australia, 91% of Australians feel stress in at least one important aspect of their lives. 50% feel very stressed about one part of their life. It's costing Australia $14.2 billion according to Medibank, due to employees being absent on average for 3.2 working days each year due to stress. So, while we may be living a lot longer lives because we don't die from infections and we have lots of amazing treatments and interventions available, why are we having so many diseases in now called chronic diseases or non-communicable diseases, which many people didn't even live long enough to get? So there is now a big shift to a poorer quality of life because we're living longer, but we're not really having a lot of life in our years. So chronic diseases, the four major ones are heart disease, diabetes, and chronic respiratory diseases, and of course cancer. But heart disease has been the leading cause of death since the 1990s, and it still continues to be. Every 12 minutes an Australian is dying from it. 31% of people globally are dying from it, and most of the world is dying from being obese and fat rather than being malnourished or starved, and that has to be one of the saddest things that I can hear. So how did we come about to even know what health principles can actually be used to benefit us? Well, we can have a look at some of our pioneers in this area, and one of them is John Kellogg. He actually is the man behind Kellogg's Wheat Bix, and he was an Adventist, and he had advocated the use of temperance in all things, or balance, a plant-based diet, fresh air, sunshine, exercise, drinking 10 cups of water every day, 8 to 10, cups of water every day, and totally abstaining from tobacco, tea, and coffee, which are very, very much the Seventh-day Adventists, what we promote. And he was a surgeon, he was on the board of health, he's published books about avoiding tobacco and how it can kill. He went on with his brother to create many vegetarian meat alternatives as well. So he was a very, very big figure in terms of helping people live a more healthful life. And Ellen White was someone also who was Adventist, and she's one of the world's most prolific, one of the most prolific writers in the world, but the most translated non-fiction American writer. And she's written so much about health. She helped even start the hospital across the road from my house called the Sea Adventist Hospital, when it was formerly known as the SAN, which advocated these principles. And so, going back to the chronic disease issues, while we've had all of these things in the past, why are we forwarded to now in this present moment? Why is the link of obesity and chronic disease so strong? Well, in 1975, we can see that most of it was yellow and orange. Only 39 years later, we can see that the percentages of obesity is climb and skyrocketed to 20, 25, and 30% globally. Now that is scary. And in Australia, yes, the average person has gained, the average weight increased by 4.4 kilograms for both men and women in a study according to the Australian Institute of Health and Welfare in 2014 to 15. And obesity is stated to be the single best predictor of type 2 diabetes. And it's not just something you can isolate, because all of our body is interconnected. When one organ suffers, the other sympathizes. So diabetes and obesity go hand in hand, as well as heart disease and stroke. And diabetes is the leading cause for blindness, for end-stage kidney disease, lower limb amputations. Okay, so all right, now let's be a little bit more positive. Back to the lifestyle medicine way of looking at things. It's not the end of the world. Chronic diseases can be prevented and controlled. Genetics loads the gun and lifestyle pulls the trigger. That is one of my most one of my most favorite quotes, because a lot of people think they're predisposed to have a disease because it's in their genes. But research is showing that by living the best lifestyle actually is the best revenge for heart attack, stroke, and cancer. And you can just follow 4 simple healthy lifestyle factors, and that can have a great increase to reversing and preventing these diseases. Actions that you can take to increase your odds of living longer are really quite simple, according to Harvard. And it really isn't that complicated. But why is it so hard for our society to do this? And how can we implement these lifestyle medicine interventions to tackle diseases? Well, you have 3 stages. You have the primary intervention, which is like health promotion and prevention and monitoring of harmful substances such as cigarettes and alcohol, as well as immunization. Then you have secondary, which is aiming to reduce and improve the symptoms when someone already has a disease or illness. And the third one is the tertiary, which is pretty much to just improve and support a disease that they pretty much have to live with for the rest of their lives, or when it has progressed to a certain point where they just, like a cancer patient in stage 4, they need cancer care groups, or someone that's had stroke or heart attacks. That is more tertiary intervention. It's just managing and maintaining their care. But the lifestyle intervention has been shown to be very effective when they did something called the Diabetes Prevention Program. So they actually had 3 groups that mirrored the 3 interventions. So they had the standard tertiary healthcare of managing a diabetic, which is just through monitoring their blood sugar and giving them the normal diabetic diet and everything like their medications. And then secondary care was people that have it and they just wanted to aim to reduce and improve the disease, so they put them on metformin. Primary prevention through a lifestyle intervention group is where they actually taught people lifestyle principles that could help them reverse and improve their symptoms, and their results came to prove that it really does work. So it was actually more effective than the actual metformin, with reducing the occurrence of type 2 diabetes by 58%. And this decreased, the second option was metformin being able to decrease it by 31%. So 10 years later, the lifestyle medicine intervention group was still managing the best with their diabetes, and it was seen to be more cost effective. So this man, Nathan Pritikin, he is someone that people call the father of lifestyle medicine, and he created the Pritikin Longevity Center in America, and that has been able to provide lots of research